Elsie Wanda. I'm a clinical oncologist. That's a doctor who treats cancer using chemotherapy and radiotherapy. Today we're going to talk about penile cancer. Yes, the penis can get cancer. So the penis is the male sex organ. It has many functions. It helps the man to be able to urinate. It has sexual reproductive functions. So the penis can develop cancer. One, you might notice that the skin around the penis has changed color. Maybe has a swelling that is bluish or blackish. That is more common in the form of melanoma. Lesions can start there. The most common cancer, however, is the squamous cell carcinoma. That's a type of cancer that happens within the penis itself. Another thing that you might notice is swelling of the penis. You might notice a growth or an ulcer that may be painless. You might also notice that the foreskin is hard to retract, something called phimosis. That means the restriction of the tip end of the penis. That too can be a risk factor to cancer of the penis. Most of the time, cancer of the penis is drained to the groin. So you might notice around the groin area that you find you have nodes, swelling around the groin. And those swellings can be an indication that you might be having cancer. For example, if you cut your toe and you have an infection of the toe, it's possible to have also the lymph node swelling. Also, if you have cancer of the penis, it's possible to have lymph nodes swelling. So the types of cancers that can be seen in the penis, I've mentioned squamous cell carcinoma. You can have melanoma. You can also have basal cell, that is skin cancer of the penile region. Why is this important to discuss? It's because most men are not comfortable to talk about any of the lesions around the penile area. And most of the patients that we see present late. However, when patients present early, about 90% of all the patients, if 100 patients showed up, 90% of them would have full recovery if the cancer is noticed early. That means there is a very important role of having a habit of examining the penis, confirming whether there is any abnormality in the penis, and coming to hospital early as soon as you notice that abnormality. So, what are some of the causes and risk factors to penile cancer? One, if you have exposure to the human papilloma virus. This is a virus that has been implicated in quite a number of the cancers. Cancers of the tongue, cancers of the throat, cancer of the cervix, and even now, cancer of the penis. If you're above the age of 60, it's a risk factor to getting penile cancer. If you smoke cigarettes, it's a risk factor to getting cancer of the penis. If your immune system is not at its best, maybe you have HIV, or you have had a transplant and your immune system is being suppressed. A suppressed immune system is a risk factor to getting cancer of the penis. And also, not being circumcised is a risk factor. Remember, lack of circumcision means the skin around that area, there is a chance for her to have inflammation. So not being circumcised is another risk factor. Then if you have what I had described called phimosis, we mentioned the foreskin is tight, difficult to retract. That can be a risk factor to getting cancer of the penis. Then also, if you've had a skin condition called psoriasis, and you've been treated with UV light around the penile region, it's also a risk factor to getting cancer of the penis. So, if you do notice a change, an ulcer, a swelling, the lymph nodes, you notice that there is the bluish or blackish lesions around your penis, or what-like lesions around it, what should you do? It's important for you to visit your healthcare provider. Show them what you have seen. Remember, most of the time when cancer begins, it is not painful. It starts painless. So do not wait for pain. Come before the pain has started so that the treatment can be early. So how do we treat cancer of the penis? One can be surgically, meaning we remove the area that has the cancer and it goes out. Depending on the extent of the disease, we may need to give chemotherapy, we may need to be able to give some radiotherapy to that area, and other forms of treatment that are possible, depending on the extent of the lesion. Remember, the earlier you come, the better. It is easier to treat penile cancer early as opposed to when it comes late. Unfortunately, most men stay home and wait until a situation whereby the lesion is so big, it is fungating, it is a big mass, and sometimes even they have to lose that organ. So do not wait for too long. Remember, human papilloma virus, there is a vaccine that can be given to boys also, girls and boys. Remember, we're not just thinking about cancer of the cervix. It's important for parents to know that if you give your son the vaccine, then you're reducing the chances and actually protecting him from cancer of the penis, cancer of the tongue, cancer of the throat, all cancers that have had a huge correlation with the human papilloma virus. So as we think about our girls, let us remember the boys too. They need to be protected. It might not be free to get the vaccine for the boys, but the vaccines are available. Talk to your doctor today. Find out where you can get the vaccine and ensure your children, even the boy child, are vaccinated against the human papilloma virus. So we say prevention is better than cure. If we can prevent you from losing your penis, then that is better than thinking of ways to augment once you have lost the penis. Prevention is better than cure. So what do we advise? One, it's important to be circumcised. If you are not circumcised, ensure you clean the area beneath the foreskin regularly. Look at that area to confirm whether there is a lesion or not. Cigarette smoking, kindly stop smoking because it's a risk factor, and then use safe sex practices to reduce the risk of you getting the human papilloma virus, which is a risk factor to getting penile cancer.